Cystic fibrosis, a genetic disease, CF for short. I'm here to inform you of four different aspects of the genetic disorder cystic fibrosis, or CF. I'm going to discuss the four common aspects of CF that most individuals ask. What is CF? How is it diagnosed? What are the symptoms? And how do you treat it? The phone rang. I knew it was the pediatrician calling. I answered the phone. Hello? The doctor asked, is this Mrs. Newman? Yes, were you able to get the test results? I asked. He started talking, but I wasn't quite sure what he was telling me. I repeated back, cystic fibrosis. Oh, okay, well, what do we need to do? Does he need to take medication? He then asked if I knew what cystic fibrosis was. I said, no, not really. I'm sorry to tell you this over the phone. Cystic fibrosis is a rare, fatal disease. Mrs. Newman, are you there? I felt like I'd been punched in the stomach as I fell to my knees, crying. I didn't know what to say. Mrs. Newman. I'm here, I replied. He then told me that he wanted to see me and my husband first thing the next morning. Was I really receiving a phone call to tell me that my year-old son had a rare, fatal disease? Yes, this was real. I was concerned. My baby was just diagnosed with a rare, fatal disease. What is CF? How did he get it? And did I do something wrong? Now that I've shared this story with you, let's begin with the first question that you or someone might have in a similar situation. The first question, what is cystic fibrosis? From the CF Foundation website, it answers this question. Quote, cystic fibrosis is an inherited chronic disease that affects the lungs and the digestive system of about 30,000 children and adults in the United States, 70,000 worldwide. End quote. And according to an article in the Medical News Today magazine, it says, cystic fibrosis is the second most common life-shortening inherited disorder occurring in childhood in the United States, after sickle cell anemia. End quote. CF is a rare genetic disease. Both parents are usually carriers. 1 in every 4 births is a possibility that you will have a child with cystic fibrosis. 50% chance that they'll be a carrier. It attacks the lungs. There is thick, sticky mucus that they are unable to drain. This is a breeding ground for bacteria, where lung infections can grow and cause serious problems with those with cystic fibrosis. It also attacks the pancreas. The pancreas is unable to absorb the nutrients of food. The life expectancy for someone with CF is 37 years old. In the Bayer Scientific magazine, Dr. Barbara Hampel, global clinical leader of the anti-infectives at the Bayer Health Clinic in Berlin, said that while sufferers' life expectancy was just under 20 years in the past, because of the improved treatments available, many are now able to celebrate their 50th birthday. What is the process of diagnosing CF? Most are diagnosed in the hospital during their newborn screenings. However, not all hospitals or all states require this. Some will be diagnosed by a doctor or pediatrician seeing some signs or symptoms. If they see any signs or symptoms, they will send them to a lab to have a sweat test done. A sweat test measures the sodium chloride in their sweat. This either confirms or denies that they have CF. My daughter was diagnosed by taking the cord blood. We found out immediately that she was not a carrier and did not have cystic fibrosis. Cystic fibrosis include different and somewhat unusual symptoms. Very salty tasting skin, persistent coughing, usually with phlegm. They have frequent lung infections, wheezing or shortness of breath, poor growth in weight, gain in spite of a good appetite, frequent greasy, oily, bulky stools, or having difficulty with bowel movements. We have spent some time talking about what CF is, a diagnosis and the symptoms. Now, let's discuss how to treat CF. Well, they take inhaled medications like albuterol. as what an asthma person would take. This opens up the airways to help the mucus come out. They also breathe medicine in a nebulizer to help soften and break up the mucus. They also wear a vest that looks like a life jacket, and it has a hose attachment, and it fills up with air and vibrates the sticky mucus out of their lungs. They cough a lot during this process. They take oral medications, like enzymes, because their body does not have the right enzymes to absorb the nutrients of the food. They take a supplement, and antacids. They need to exercise to help strengthen their lungs to fight infections. They need a strong, healthy, high-caloric diet. This can be anywhere from 3,000 to 5,000 calories a day for a child with CF. There is also supplements. They lose a lot of salt, especially in the sun. They need extra salt and a multivitamin to compensate for the lack of nutrition, digestion in the food. They take probiotics to increase the protection against constant antibiotic intake. Now that you know what cystic fibrosis is, including the symptoms, the diagnosis, and the treatment, maybe you can see my stunned reaction to finding out that my son had a rare fatal disease. Everything is real. My baby was diagnosed with a rare disease, but everything's going to be okay. There was nothing I could have done to prevent it. It is hard to diagnose because it doesn't affect the mind or the physical body. It is all internal. It was a relief to finally know, so I knew how to take care of my son. He is extremely happy and healthy. He is now 8 years old, and he's so smart and perfect. He loves sports and is very active. We look at CF as a positive part of our life and include it in our daily routine, so it's not a problem. In fact, his little sister is jealous that she doesn't have CF. Often she will say it's not fair that he has CF and he gets to go to the doctor. Now, one day she will realize that CF is challenging for her brother at times, but for now it makes him feel good. He has a lot of great supportive friends and family that play with him while he does his treatments. We pray every day that CF will eventually stand for cure found. Thank you.